This morning, we're continuing our month-long conversation on mental health awareness. For those seeking mental health treatment, navigating options can be stressful. This is why behavioral health company Acadia Healthcare is making it simple through its nationwide network of experts. Brooke Martin with Acadia Healthcare is here to explain how the company uses treatment placement specialists to help people find the right clinical care. Good morning. Thank you so much for coming in. Right being the key word here, right?
Good morning. Yes, absolutely. There's a lot of people that seek treatment and they really don't know where to start.
Yeah.
You know, when you're ready for treatment in mental health or substance abuse, that's an important moment. And if someone
It's a
reaches
vulnerable
out,
moment, an overwhelming
Yes.
moment.
Yes, and so what Acadia did several years ago is they realized that they needed people to help others navigate the system. And so that's what we do across the country. So if someone's ready for help, however they find out about us, they can give us a call and we can help navigate to whatever treatment is appropriate based on clinical presentation, location, financial situation. Their motivation is a big part of it too. So it helps, makes things a lot easier for the client and helps develop rapport, because Googling answers to mental health, really isn't the answer. It's not a relationship, and that's what you need when you want to trust somebody.
Yeah, and at that moment when someone comes forward and says, hey, I need help, they are vulnerable. This process can be overwhelming, and finding that care that's special to them, that's specific to them, is key in making sure they get the help they ultimately need.
Yeah, in my background in administrative in the mental health care environment, if someone gets the wrong type of care, it can be very detrimental and they won't get care again.
Yeah.
So there's different levels of care. There's the acute care environment, which is the more of a crisis. A lot of people are familiar with those situations because it gets to that point. But if it's not to that point yet, there's also lower levels of residential treatment, which is like a 30-day deep dive into trauma, PTSD, mood anxiety disorders, even eating disorders. There's all sorts of places for that. Below that, there's outpatient, there's day treatment programs. So there's a lot of different levels of care that are tailored to meet someone's need and wherever they're at. And so that's what we do, is make sure they get the right treatment for the clinical presentation and the needs that they have, as well as their financial situation.
It's a delicate process. It's one that it's not one size fits all. And so talk to us a little bit more about those disorders that people can reach out for before it comes to a point where it's too late.
Right. Well, if someone has experienced a lot of trauma in their life, especially younger, and they're adults, and those things start coming up in daily situations and starts getting in the way of their ability to function every day. That's a good time to reach out. So trauma is a big one. PTSD for different groups of people, like military, veterans. There's specialty programs for all sorts of situations, LGBTQ, and so when we talk to people, when I talk to someone, I find out what their main buckets of issues are. And a lot of times, you don't have substance abuse without some mental health issues. And so we have to find
hand in hand.
They do, and so we have to find a place that's going to treat the right thing.
Yeah.
And there's also mood and anxiety disorders. There's schizoaffective disorders, and not all of them are crisis.
Yeah.
I encourage people, let's get some help before it becomes a crisis.
Let's have that conversation now before it gets to that point. I'm so glad you brought up the specialized programs, because you're right. We have so many different groups, so many different communities out there that their needs are different, their experiences are different. And so meeting them where they are at with something that's specific to them, again, is key in recovering and hopefully living a healthier life.
Right. I mean, PTSD for a first responder is really different from PTSD of a childhood situation.
Yeah.
So our company actually has specialists that deal just with the first responders and finding them treatment. And they themselves have been in law enforcement, and so they can understand what the person has been through.
For people watching right now, if they know someone who is in need of help, who they want to intervene, they need to seek that help, what would be your advice to that individual that has a loved one?
I think education is very important on knowing which level of care would be appropriate. So you can go online, you can go to our website, which is treatmentplacementspecialist.com, and find the person that's near you if you're not in Houston. I can always help. And I think just speaking it,
Yeah.
not ignoring it. If you know someone that just has had a change in behavior, has had a change in their daily routine, maybe has quit going to activities, or they're having trouble getting through the workday, say something and say, everyone says to ask people, how are you doing?
Yeah.
How are you today? And that's those simple words.
Yeah, can go a long way.
It can really break through. Yeah.
What about the person who's struggling in silence? We've talked about what loved ones should do if they have someone that is obviously struggling. But what about the person struggling in silence? Because this can be overwhelming to the point where people don't exhibit signs, right? They don't show their loved ones that they in fact are drowning. What would you say to that person?
Well, I think that there are signs. I think that in most cases there's something
that indicates there's something wrong.
Yes, and it could be a change in their, like I said, their behavior, their routine, their motivation, eating habits, sleeping habits. And there's a lot, and you start as easily as saying, hey, let's go to the doctor and get you checked out, make sure that you're okay physically. And then that can lead to, it's stress, and what's the stress caused? So there's a lot of way to do it, and there's also interventionists that are out there available that we can connect with that can provide that for the family too.
Is there a cost associated with your services?
With me, no.
Okay.
No, the company just has us do this great job, and we help people, no strings attached.
Yeah. What is your favorite part of helping people in need when it comes to making a difference in how they live their lives today and, of course, tomorrow?
Well, all my life I've loved connecting people to resources.
Yeah.
That's been what kind of makes me happy.
Connecting those dots.
Right, and if I get a call from someone and I go, I know the person you need to meet, whether it's professional people, connecting a client to a resource, that's what makes me happy, because I know they're getting the right connection and the right care. That, and hearing in this position I'm in, hearing from families months later that they went to treatment and are doing well. That is a huge reward. Because families, it's a family unit issue a lot of times with mental health. It's not just this one client. The family's suffering, they need education, they need support. Even when they get out of treatment, we encourage them to get further treatment when they get home if they go somewhere. It's a process, it's a continuum of care that has to happen. You just don't go to counseling 4 times and it's done. The brain holds a lot of trauma in your body, and once that is treated and opened up, you have to take care of your body and your brain.
And sometimes we talk about, having to reach out beyond your nuclear environment, right? Reaching out to those services that can help, that's beyond just your loved ones. We so much appreciate you coming in today. It's Mental Health Awareness Month, obviously, and so to be able to have this conversation this month is critical, but also to remember that the work continues all year long.
Yes, thank you for having me.
Thank you so much, Brooke, for coming in.